Hi, I'm Dr. Allison Jackson. I am a medical doctor and I am a psychiatrist. I am working at my private practice called Mindful MD Psychiatry, and I see the whole vast array of different types of patients that I love working with people of all different backgrounds, all different diagnoses, but I do have some niche interests that I really enjoy working with and some specialties that I find to be really important. And the ones that I probably see the most of are people that have ADHD, adults with ADHD, so maybe people that have lived with ADHD since childhood and have been diagnosed when they were kids, but also people that maybe are wondering, do I have ADHD? And I need to have that clarified. We need to figure that out. And kind of figuring out, okay, is this what this is, or is it something else? Is this a medical condition that's leading to ADHD-like symptoms? Is this a symptom of a different psychiatric condition? And then treating that. I also work with a lot of people that have what we call body-focused repetitive behaviors. These are things like trichotillomania, so hair pulling out, or excoriation disorder, where you're picking at your skin and causing a lot of damage there. It can have some relations with OCD, but it also can have some different root causes as well. I really enjoy working with those folks and seeing the huge changes that can happen, where you can go from maybe losing all of your hair to growing that back. You don't have to have this repetitive behavior that's overtaking a part of your life. Other kind of niche interests, working with people that have struggles with their sexual health, whether it's kind of a low libido issue, such as medications maybe causing you to have low libido, and we need to make sure that we're either adjusting your medications or making do with your medications and trying to get it to the point where we need to be and improving those libido issues, whether by adding a different medication or finding you a therapist that really works really well, such as our friend here. That's another place that I really enjoy working with. I do a lot of college mental health. I enjoy working with young folks, but definitely millennials. I see a lot of millennials. I'm a millennial, and I enjoy this group where there's a lot of curiosity about mental health and improving your mental health. Lastly, my specialty area is probably in trauma disorders of someone that is struggling with, like, okay, is this a borderline personality disorder? Is this something like complex trauma, complex PTSD, or is this PTSD? Where is it on this spectrum? Helping people through that. Also, diagnostic clarification. Do I really have bipolar disorder? I'm on this whole laundry list of meds that have never done anything for me, that's not served me. Have you been misdiagnosed? Let's clarify that for people. I also have folks that come to me that want to have their medications, they want to come off of those, and so helping people do that is another area that I enjoy working with them on, of clarifying diagnosis, coming up with a plan that, is this a time in your life where it's time to come off the medications? Because for many diagnoses, that is something that can happen, and I think is important for psychiatrists to really think about. These meds don't need to be a forever thing for many people. It may have served them at one point in their life, and now they're ready to try either a lower dose or come off the medicine altogether, which I think is important to be able to do that in a safe space for us to monitor and make sure that it's something that you can do and feel good about, and that you can live your life in the way you want to live it. Yeah, those are probably the main things. The only the extra one I guess I can think of is that anxiety, people that have medical kind of anxieties, people that have health anxieties is another area that I enjoy working with, because there's a lot of stigma there. People that are struggling with either finding a diagnosis for their medical condition, and they have been told that this is all in their head, and so being able to work with them on their own medical anxieties, but also if they're struggling with a chronic illness and kind of anxieties and depression that can come with having a medical condition, such as having cancer or having POTS or any of the kind of newer stuff that's coming out with, the more evidence that we have, a lot of these things can have connections to mental health, and being able to work with people around those things is really exciting to me. So, yeah. I work with a whole array of things, but if you want to find me, I'm at mindfulmdpsychiatry.com or at mindfulmd psychiatry on Instagram, and I'm also on the Facebook. So yeah, reach out. We do 15-minute consultations. Happy to chat and see if mine is a good practice for you.